Standing now in the trauma center here at the Rideout Emergency Center with Amy Ashford. Mrs. Ashford has contributed more than 1,000 hours of volunteer work here to the Rideout Hospital Auxiliary. Amy, tell us about the work that the auxiliary does here in the emergency center.
Well, there are several things we do, Dr. Peppercorn. First of all, going through a normal procedure, we will greet the patients as they come through from the ambulance entrance. And then we take them to a registered nurse and have them evaluated and then show them where they can sign in and give the information for insurance. Then if an ambulance rolls in, we go out and get a warmed bed blanket out of the autoclave and cover the patient. And also we, in between, we keep the beds clean, change the sheets. Also, the nurses may ask us to run to the lab to pick up lab slips. X-ray slips, in-service slips of all sorts of things. We get material for them. In other words, what we do is to take off the work from the nurse that would take them away from the patients.
Do you have much interaction with families waiting for their relatives?
Right. We do. With the nurse or the doctor's instructions, we go from the patient to the family out in the waiting room and give them what the nurse and doctor has told us to say. In other words, so they feel they're part of it and they don't worry. And we also serve them coffee.
Excellent. I should mention that our program, The Medical Explorer, will be returning to the emergency center here soon to see some of the medical activities that goes on. And I'm sure that we'll see the volunteers in the background in this case helping out.
I'm sure you will. Yes.
Thank you.
You're welcome. Thank you, Dr. Peppercorn.
One of the newest programs added to the activities of the Rideout Auxiliary is the outpatient surgery area, which is called Oscar. With me is Helen Gabhart, one of the members who's given many, many hours of volunteer work. How many hours have you given here?
Oh, maybe about 300.
300 is quite a lot of hours. When you think about,
I haven't been here very long.
Well, that's quite a bit, though. If you think of a 40-hour-a-week work week, if you were working full-time, that would take quite a bit just for that, and most people aren't here full-time. So 300 hours is quite a lot of hours. Where are we now? This is the outpatient surgery area.
This is the Oscar unit, where the day patients are admitted here and go into surgery from here. And then after recovery room, they come back in here before they go home.
So the purpose of this area is actually to save money for patients. They don't have to stay overnight.
No.
And they have the procedure done, and they come back here as they recover from the anesthetic, and then they're out.
Well, no, they're in recovery room.
Oh, recovery first. Okay.
And then here just before they go home.
I see. And what does the auxiliary do here?
Well, we talk to the relatives while the patients are in surgery and serve them coffee, and we come in here and talk to the patients before they go into surgery. And then we have lots of babies, sometimes as little as 6 weeks old, and then young children, and we help the mothers with them.
So here you're really working as a liaison between the staff of the hospital and the patients and their families, giving information and assisting them in that way.
And sometimes the relatives will be concerned about it taking so long, and then we go into the recovery room and get information from the girls in there and give it to the patients.
Another important activity of the Rideout Hospital Auxiliary is the Patient Representative Program. The goal of this program is to make the patients feel as comfortable as possible by providing them and their families the needed information and counsel that help relieve the anxieties surrounding a hospital stay. Most important, of course, is the personal touch, which I'll let you see now.
Hi, how are you feeling today? Much better. I'm Sue DeLeon. I'm a pink lady. Can I do anything for you?
Would you mind raising the desk?
Sure. You tell me when to stop, okay?
That's fine.
Okay. Can I do anything else for you? We have drinks that I can get you after I check with the nurses.
I'd like a Diet Pepsi.
Okay, would you like that with ice?
No.
Okay, and can I do anything before I go get it for you?
For my hair isn't a mess. Would you mind brushing it just a little?
Okay, hold on, I have to get your brush. Tell me if I hurt you, or I won't hurt you.
No, that looks good.
Okay. You having somebody come visit you today?
Okay. Then move it up.
Okay.
That's fine. Thank you.
Great. Oh, I have a piece of mail for you. Would you like me to open it?
Yes, would you please?
Okay. you like me to read it for you?
No, thank you.
Okay, there you go. Okay, then I'll go get your coat. Is there anything else?
I'm a little chilly. Would you mind getting the blanket?
Okay, I'll see you in just a few minutes.
Thank you.
We've had the chance today to see the excellent work of the Rideout Auxiliary here at Rideout Hospital. We've seen their work with the gift shop, the patient information desk, their work in the outpatient surgery department, and their work at the emergency center. But before we close today, I'd like to introduce Jan Casey, the vice president of the auxiliary this year. Jan, you were going to show us some very nice plaques that commemorate your work.
Yes, I was, Dr. Peppercorn. These plaques commemorate very many hours of service by our volunteers to the hospital and thereby to the community. This one, as you'll notice, is in recognition of 1,000 hours volunteer service, and each lady has her name on a little gold plate. There are 76 of these ladies.
76 have given more than 1,000 volunteer hours.
Yes, that's right. And if you'll notice, next to some of the names is a little star or an asterisk. This represents a past president.
I see, I see.
And in this plaque, right behind you, this is in recognition of those ladies who have donated 2,500 hours and over. And
It's hard to imagine 2,500 hours of volunteer work.
That's a lot of dedication, isn't it?
Certainly is.
There are almost 40 of these ladies. And I must mention two of our ladies. They are Callie Allison and Marion Lee Barron. And each one of these ladies has donated 6,000 hours to the hospital auxiliary. And we're very proud of them. We're very proud of all our ladies. And I'm proud, too, to be a member of the Rideout Hospital Auxiliary.
Well, I feel honored today to have had the chance to meet with your organization here and see their services. And will you express my thanks to them for allowing us on the Medical Explorer to come out and meet you today? Thank you very much.
Thank you very much, Dr. Peppercorn.
It's my pleasure, too. Thanks. The members of the auxiliaries of Rideout and Fremont perform extremely useful and helpful functions in our modern medical care system. The next time that you're visiting patients at Fremont or at Rideout, why don't you go up to one of these volunteer pink ladies and express your thanks for their superb volunteer work. I know that I plan to do that the next time I'm over there. Let's switch